How's your week been going?
Well, I went to my sister's wedding this weekend.
Oh, wonderful. How'd it go?
I ran into my cousin, and I had no idea that his girlfriend was a psychologist. It's really awkward. I had no idea you were dating my cousin.
You sound upset.
Of course I'm upset. Our therapeutic relationship should be private.
Well, I can assure you as a psychologist, I can't legally discuss patients without their consent. And besides, I didn't know he was your cousin at the onset of therapy. It's been over a year now and there hasn't been a problem.
I guess.
So I think I'm really depressed, but I'm not sure. I mean, I'm 35, but I can't seem to act my age or even get out of bed in the morning.
Well, I really only work with children with behavioral issues, but I might be able to help you out.
Wow, you can really do that?
I think so. You know, I've read some articles on depression in adults, so I think I might know how to treat you. I say we start treatment.
Oh, you sound so confident. Let's schedule.
I can't stand when my boyfriend doesn't pick up after himself. It causes me a lot of anxiety when I see a mess. I like to keep the apartment clean at all times.
When did you first start feeling the need to keep everything clean?
Since my childhood, but it seems to have gotten a lot worse since I've been in a relationship.
It seems to me that your id and ego developed a conflict during the anal stage of your childhood. From my expertise, your parents potty trained you too harshly.
This is ridiculous. Outdated Freudian theory shouldn't be the only reference to address my anxiety.
All right, so it looks like time's up for this week. So shall we make an appointment for the same time next week?
Yeah, let's do it. You know, I was kind of stressed coming into here, but you made me feel a lot better.
Well, that's normal with the first session of therapy, but with time, it'll get easier. So real quick though, before you leave, I just need you to sign these forms for me.
Sure. Here you go.
All right, looks good. All right, see you next week then.
All right, bye.
Oh, hey!
Hey, it's me. You're 20 minutes late to our session. What's going on?
Oh, man. I thought I told you I was going on vacation this week. Just come back next week at the normal time and we'll catch up, okay?
But I'm feeling depressed today.
Sorry, I can't hear you over the sound of the ocean. You'll be fine. See you next week. Bye!
Ugh.
How have you been feeling lately?
I think I've been doing a lot better lately. I still have some problems with my dad, but things have been getting pretty good. My mom, though, I don't know. I want to see her. I feel like I haven't been spending time with her. But every time I think about flying out, I get panic attacks. I'm just terrified of flying. I don't know what to do.
Well, we can continue working together. You're making progress, but I think you might also benefit from short-term cognitive behavioral therapy to address your fear of flying.
Okay, now what is that? Can we do that here?
Well, I can refer you to a psychologist who specializes in CBT. Let's talk about CBT and how we can integrate the two therapies and address any concerns we might encounter.
Doctor, I'm really not getting anything out of this. I think we should stop therapy.
I really don't think that's a good idea. There are a lot of things I still want to go over with you.
But we've been going at it for weeks, and I just don't feel any different.
You really shouldn't stop now. There are a lot of issues of yours I would really like to address.
I just want to stop.
Look, if you stop now, you could cause irreparable damage to your interpersonal and social functioning.
Fine, I'll stay, but I just really don't think I'm gonna get anything out of this.
Alright, well, let's just push ahead and see what we can accomplish, shall we?
Whatever.
Thank you for seeing me today. I've really been having some troubles that I don't know if I can fix.
Well, if you put in the work and see me every week, I can guarantee you'll feel better.
Really?
Of course, I have a 100% success rate. I can certainly do the same for you.
Wow, that's amazing. Let's get started right away.
Thanks, Doc, for listening to me and my wife. I'm sure you'd rather be, doing anything else today.
But this is her job. This is what she wants to do today.
Well, I really just want to work through the issues in your relationship.
Relationship? What relationship? He barely talks to the kids anymore, let alone me. He doesn't even come home.
Look, you know that losing my job wasn't easy for me. You know it's been hard for me, and you know I've been trying, okay?
Whatever, this is over, right? I'm gonna leave first.
Hey, Doc.
Is there something else you wanted to talk about?
Yeah, I think my wife might be trying to take full custody of the kids. Would you be able to testify in court on my behalf?
Well, you and your wife are seeing me as a couple, so that makes both of you my clients. Therefore, I can't really testify for you because I would be going against your wife, and that would be violating a trust that she and I have. So I'm afraid not.
Okay, I understand that, but do you really want her to get full custody of our kids?
I do understand where you're coming from. I do understand. But my role in this situation is to help you two reconcile or come to some sort of agreement in your relationship. I think maybe you would want to see a lawyer or something of that nature if you wanted legal advice. I am not in the position to give you any legal advice. But if you wanted to talk to me in a therapeutic sense about your wife, I would be more than happy to listen. I hope you understand.
Alright, fine. I understand, I guess. Alright, Doc. So that's it. I'll, see you next week then.
All right, I'll see you and your wife next week.
Hi, it's nice to see you today. How have you been feeling?
My girlfriend's been cheating on me. I heard her talking on the phone to somebody else the other day.
Did you ask her who she was talking to?
No, but, I can tell, right? From the way she's been acting.
How has she been acting?
Look, you're not listening to me, okay? Why am I here paying to listen to you and you're not listening to me? So listen to me no, give me that. Listen to me or I am you better watch your back, okay? You better watch your back.
The past few sessions, you've seemed really uncomfortable with me. I can refer you to a different psychologist, or we're gonna have to end our therapeutic relationship now.
I think that might be best, okay?